Hello everyone, I am Dr. Rashid Hassan, the founder and CEO of DentoScope Institute of Research and Advanced Dentistry. Today's topic is about the elastomeric impression materials or rubber-based impression materials, you can say. In the previous lecture, we discussed about the introduction and the classification of dental impressions. We also talked about uh, the non-elastic impression materials and the aqueous hydrocolloids. So today, mainly, we are going to focus on the non-aqueous elastomers. This portion we have already covered these two. In today's lecture, I'm going to talk about the elastomeric impression materials, the techniques for using the elastomeric impression materials. Then we will also talk about the electroplating procedure for impressions, and finally the cross-infection control or disinfection of dental impressions. So let's get started. First, a brief introduction about the rubber-based impression materials, which are also called as the elastomeric or elastomers in simple language. The elastomers, they are basically rubber-like material with long chain polymers. Well, they are basically the polymers. If you have an idea what exactly a polymer is, the polymer consists of many small units which are called as monomers. The monomers, they combine with each another to form a large macromolecule which is called as the polymer. So all the elastomeric impression materials, they are polymers, and they have a glass transition temperature which is lower than the normal room temperature. So let me talk about the glass transition temperature first. I want to discuss this to make things clear. um, Glass transition temperature is that temperature on which there is certain mobility seen among the molecules of uh, among all the molecules in a polymeric chain. Well, once the polymeric chain, it undergoes any sort of stress like temperature the molecules, they become mobile. And when they become mobile due to temperature, they take another form. This is basically a transition of one form into another at a specific temperature, and the temperature at which this occurs glass transition temperature. So transition temperature is lower. Then I'm going to talk about the process, main disadvantage, I would say, because of which the aqueous hydrocolloids were not very suitable for the details. These were poor tears resistance. Well, basically, if you look at it, the impression materials is a transition process of, you can say, the evolution. First, we had the impression plasters, then we moved towards the elastic impression materials like hydrocolloids, agar, and alginate. And when we got a few good properties of elasticity from agar and alginate, but there were certain properties like tear resistance and dimensional stability, which was very, very poor among the so that's why there was a need to get a more sophisticated, more accurate impression material, which is the rubber-based impression material or elastomers. So to overcome these two problems, the elastomers were formed. Well, they are basically mostly in the form of the paste-paste formulation. There is a catalyst paste and then a base paste. These two pastes are mixed together, to form an elastic rubber like material. Well, this is basically a rubbery material having the elastic properties. All the elastomeric impression material, they exhibit excellent elastic recovery. Few have good, few have slightly less percentage of elastic recovery, but they all have excellent elastic recovery as compared to the other, like the aqueous hydrocolloids. So there are few general properties of these properties from three different books, and I have summarized them here so that you can have a clear idea of what we are going to discuss today. So you have these properties, general properties in your mind, and you can clearly understand whatever I'm going to teach you. Then there are more the elastomeric material that it redefines the elastomers, which are not very well recorded by agar or alginate or any of the rigid impression materials. Elastomers are the material, the rubbery material, which have the ability to make those fine margins accurately and so that our prosthesis, whatever prosthesis we are going to give to the patient, or even for improsthesis, the image, the it is exactly what is required by the patient. So we get the image so that it fits accurately into the patient's mouth. Secondly, these all elastomers, they are hydrophobic in nature. They are accepted by the patient. And silicone, they are hydrophobic. Well, that's a general perspective about them. Well, they have excellent elastic property. As I've told you that the impression materials are basically an evolutionary process. During this evolution, the rigid impression materials, they were replaced by agar and alginate. After that, the agar and alginate were replaced by much sophisticated and much better materials like elastomers. And these elastomers also have better properties than its predecessors. The main property is the elastic one. We wanted a material which could replace all the undercut areas, and the elastomers are simply those materials. Then they have high coefficient of expansion. That is also a very nice thing for elastomers. Then they have excellent tear strength. So, what does that mean? That whenever you record an impression from an elastomer and then you remove it from the oral cavity, it will always record the undercut area. It will break into the undercut area, the area between the two adjacent teeth. It is going to record that area as well. So it's not going to tear away either in the form of a bulk material or also in the undercut areas. It's going to record the fine details. Then coming to the property of electroplating, the electroplating can be done by copper or silver. I'm going to talk about the process of electroplating in the later stages of this lectures. I have compiled all the procedure so you can get a clear idea of what exactly the electroplating is. So electroplating has a good shelf life, approximately, and it is always suggested to use a less expensive impression material in respect to the other ones. So it should have a good shelf life, and a shelf life of about 2 years is ideal, I could say. So if you want to increase the shelf life, you should keep it in the cool conditions so that the shelf life could be increased. Then the dimensional changes. Well, this is a polymer, so it is going to polymerize by one way or the other. So in this way, The dimensional changes are bound to occur. They can be due to the curing shrinkage, because whenever the polymerization reaction occur, it is always accompanied by the polymerization shrinkage. Then there is a loss of byproduct. The byproduct is formed by the condensation polymerization reaction. Well, condensation polymerization reaction is the one in which water or alcohol is released as a byproduct, and due to this release of byproduct, the dimensional changes occur. Incomplete elastic recovery. There is no impression material which has 100% elastic recovery. There is always some discrepancy in the elastic recovery, because whatever process the impression material goes through, it will not completely recover elastically. Although the elastomers have excellent elastic recovery, about 97, 98, 99%, but ideally it should be 100%. But, well, that is not at all possible in case of the elastomers. Then the incorporation of the filler content. The filler content, they play a very important role in the general properties of the elastomers, because more the filler content, less shrinkage is going to happen. But this is vice versa, the inversely proportional thing, that if you have less fillers, the shrinkage is going to be more, and if you have more filler particles, the shrinkage is going to be less. The polyethers, well, they are the only hydrophilic materials, the only hydrophilic elastomeric impression material. The other three are hydrophobic. It absorbs water. Because it is hydrophilic, it is water loving, so it takes in the water, it takes all the water, soaks it, even from the oral cavity, the oral tissues, because oral cavities, as I told you, is always covered with the saliva. And when it is covered with saliva, the polyethers, they take that saliva as well, but while taking the water content or the saliva, they lose some of their important constituents like plasticizer. When they lose it, the dimensional changes are bound to occur. So it means one of the constituents of your composition is leached out. So the changes in the dimension are always going to occur. Then thermal contraction is always seen when it is transferred from the oral cavity to the room temperature, because whenever it is loaded into the tray and into the patient mouth, the temperature of the oral cavity, while it is different from the outside environment, the normal temperature of the oral cavity, it ranges from 32 to 37 degrees centigrade, and that also depends upon either the oral cavity is open or closed. In case the oral cavity is closed, the mouth is closed, the temperature is always going to rise. And in other case, if the patient is breathing through mouth, the temperature is always going to be lowered. So, but still, there is a difference in temperature in the oral cavity as well as in the outside environment, and this difference is due to cause the dimensional change. And then, lastly, the time of pouring. Well, ideally, every impression must be poured as soon as possible. As soon as you record an impression, you have to disinfect it. Just disinfect the impression. I'm also going to talk about the disinfectants used for the dental impression in at the end of this lecture. Do listen to that. It is very informative and a very important university question as well. So after disinfection, it should be poured with the hard plaster or extra hard plaster to form the cast. So pouring should be done as soon as possible. So again, the same thing. The elastomers. The elastomers are of three types: polysulfide, silicons, and polyethers. The silicons, they are divided into two types: the subtypes addition silicon and the condensation silicon. Depending upon the polymerization reaction they go through, obviously, as the name indicates, the addition silicons, they undergo the addition polymerization reaction, and the condensation silicones, they undergo condensation polymerization reaction. So let's go through these elastomers one by one. So the very first elastomer which was introduced into the market was the polysulfide elastomeric impression material. It was the first one which was introduced into the market as an highly sophisticated elastomeric impression material. There are different alternate names given to this. First, by the name of the manufacturer, it was also called as thiocol impression material. Then, due to its chemistry, due to the presence of impression material was the name given to it. Then, by the processing, called as vulcanizing impression material. Vulcanizing is a process of the stiffness or hardening of the rubber material. Any rubber material, uh, the process by which it gets hardened is called as the vulcanizing process, and due to this process, the name was given as vulcanizing impression material. So, next. Now let's talk about the general properties of the polysulfide impression material. I'll quickly go through each one of them and try to explain them to you in an easy way. Okay. The first one is the biological properties. Biologically, well, this thing is very much important that biologically, every material, it must be biocompatible. It should not cause any toxic or any harmful effect to the orodental tissues. And same is the case in case of the polysulfide impression material. It is non-toxic, non-poisonous, but there are certain problems like bad odor or like bad taste. The color is also very bad, uh, and this is due to the presence of the lead dioxide in the composition of polysulfides. The lead dioxide, it gives a very bad odor, and it is very difficult for a patient to get the impression recorded with polysulfides due to this bad odor, and the this is due to the lead dioxide. And then it is easy to disinfect by glutaraldehyde. So I have told you that in the end of today's lecture I am going to talk about the disinfectants used for dental impressions. I will talk about each and every impression material and the method by which they can be disinfected. It is a very important university question, so please pay attention while I'm doing so. So next we talk about the rheological properties. Rheological properties are basically the properties of flow of a material. Rheology is the study of flow of a material, and the rheological properties, well, they suggest that the polysulfide impression materials, they are available in all four consistencies: light body, regular body, heavy body, and putty consistency. The polysulfide impression material available in all these four consistencies in the market, and you can use any one of them according to the need and according to the area that you want to capture. So working time is 3 to 6 minutes. Okay, that is good working time. It's good for the dentist that the working time is about 3 to 6 minutes, because it makes very much easy for not only for the dentist as well as for the technician as well who is mixing it. So he can take his time to mix the dental space very easily. So the dentist can keep the oral cavity dry and prepared for the impression tray in 3 to 6 minutes. But the problem arises here in the setting time. Well, you look at the setting time, it is 10 to 20 minutes, which is quite a large setting time. Well, if you look at it from a patient's perspective, as I told you, if in the previous definition of the biological properties, that it has a bad odor. it has a bad color as well, right? So keeping such material so close to the nasal cavity while recording an impression for about 10 to 20 minutes is impatient, right? If a material takes less time, if the color and as well as the odor, the smell is also good, then keeping a material inside the patient mouth for about 20 minutes is not at all justified. But at that time, we had no choice because this was the first elastomeric impression material which was at that time it was the best. So these are the things which were the disadvantages and which were kept in mind so that we could make a much better elastomeric impression material, right? The setting time, although the working time is good, it is large working time, but still the setting time, it destroys everything. It destroys all the good properties as well, because keeping a tray with a bulk of a material inside the patient's mouth, which has a bad odor and a like bad color, so it is going to be very difficult for the patient to keep it. Then mechanical properties, highly flexible of all the elastomers. This polysulfide, which was the first made the elastomeric impression material, it was highly flexible among all the elastomers. The elastic recovery, well, it improves with time. It is viscoelastic in nature. The elasticity improves with time, but still the elastic recovery is not as good as the other elastomeric impression material. We'll go through each one of them, then you will going to see yourself that elastic recovery, although is very good, but there are other elastomers as well which has the elastic recovery much better than this one. So it is not dimensionally stable. Well, that is not a good thing because we only prefer the elastomeric impression material because of the dimensional stability. If that is not good, so that's not going to serve our purpose. So the cast should be poured as soon as possible, as the material is not dimensionally stable. And as I told you, also in the general properties, that the filler play a very important role. So more the filler, less the polymerization shrinkage is going to be. So now let's compare the advantages and disadvantages. The first advantage of the polysulfide impression material is longer working time. I mentioned you that 3 to 6 minutes is a good enough time for any for your assistant to easily mix the toothpaste. So he can easily mix the toothpaste and get the required consistency. So 3 to 6 minutes is good enough time. So flexibility is high. That is a good advantage of the polysulfide. Then high tear strength. So we have no problem while dislodging the impression from the patient's mouth. The undercuts are going to be recorded. That's a good thing. So this material can also be electroplated silver. I'll electroplating in the later stages of today's lecture. So this can be electroplated. Okay, it has a good shelf life, long shelf life, and that is what is required because shelf life in elastomers is also very important. Elastomers are very sophisticated impression material. They are very expensive one, so they need to have a good shelf life, a long shelf life, because this is not just a routine material. The patients that you get are, I mean, very less for an inlay, onlay, or an implant prosthesis. So that's why what should be your main aim, it should be to have a material with a long shelf life so you can store it and then reuse it whenever you are required. So 3 to 6 months or more is a good time period for a shelf life. Expensive as compared to the other elastomers, yes it is, although it is very expensive, but it is very in you can say less expensive when we'll see the other elastomers price. So disadvantage, well, unpleasant odor and taste. Well, as I told you, that's a big disadvantage. And then the long setting time, about 2 minutes. Well, that's a very big disadvantage for a material not having a good taste, not having a good smell. So that's a very, very big disadvantage. Then dimensional change due to the byproduct formation. Byproduct is formed that clearly shows that the polysulfides they get polymerized by condensation polymerization reaction, in which water or alcohol is byproduct formed. So that's why the polysulfides they have dimensional changes, which is not good at all. So lead dioxide, as I told you, lead dioxide is present. So the due to the presence of lead dioxide, if some drop is, you can say, is dropped on your clothes, the staining may occur. So that's not good thing, and these stains are not removable as well. So it ruins your assistant's clothes or the dentist's clothes. So multiple dye pouring is not accurate. So we need a material from which we can reproduce multiple dyes, multiple casts. And why this is important? Well, I have also included the duplicating impression materials in the coming slides, so you can get the idea why we need to have such impression materials which can duplicate the cast. We can have multiple casts from one impression material, and why this is important. So this polysulfide it does not have the property of multiplying the casts in an accurate way. We want accurate multiplication of the casts. So they are basically used for the crown and bridge prosthesis, the inlays, onlays, and the partial denture formation. Well, partial denture that are referred here are not those polymeric. Well, keep this thing in mind that denture based materials are of two types: the metallic denture based materials and the polymeric denture based materials. Polymeric denture materials are those pink ones, in a layman language, those pink denture based materials, those are polymeric. But here they are referring to as the metallic denture base, the cobalt chromium denture based materials, which are the base is made up of metal. So for those cobalt chromium partial denture bases, well, polysulfides they are indicated. Then coming to the condensation silicon impression material, well, as I told you, there are two silicon elastomeric impression materials: addition silicon and the condensation silicon. This condensation silicon, this is the first among the silicon impression materials to be manufactured by the material scientists. So it is first of the silicons, and it has those properties which were not as good as the addition silicon, because it was the first one. So you will clearly see the process of evolution going of the impression materials. So the alternate names, well, alternate names I have mentioned here because I have collected this lecture from three different books, the Phillips, Craig, and the McCabe. So I have given all the valuable information here in one lecture, so you don't have to search for two, three books here. So if in the exam, if the question is asked from any of these names, so you should have an idea that what material they are talking about. The conventional silicon, since they were the first one among the silicons to be manufactured by the material scientists, so they were named as the conventional silicons. Then room temperature vulcanized silicon. As I told you, vulcanization is the process of hardening or stiffening or setting of the rubber material. Any rubber material, different processes are there, and one of those processes is vulcanizing. So vulcanizing means the setting of the rubber material. So it sets at the room temperature. That's why it is called as the room temperature vulcanizing silicon. Here in the picture right in front of you, you can see these putty consistency available in tubs. Then you can see the cartridges of base paste and catalyst paste. You can also see the paste, the collapsible tubes of the two types, like base and the catalyst one as well. So it is also available in all four consistencies. Okay, let's move ahead. Biologically, the condensation silicons, well, they are non-toxic. They have acceptable taste and color. Well, that was a problem which we were facing in the polysulfides, where the color and taste and the smell were the main problems. Because it is quite simple. You are going to use these impression materials inside the oral cavity, and the nasal cavity and oral cavity are quite close to each other. So patient easily senses or smells any bad odor, or like the tongue is also there, any bad taste. So these patient can easily appreciate them. And then if they are not at all acceptable, patient is it's going to be hard for you as well to record an impression. So good taste and the acceptable color is also very important, and acceptable smell as well. So it has a good taste and a good odor. So that's quite a positive thing for the condensation silicones. Then rheological properties. Well, the flowing properties, I told you rheology is the study of flow of a material. So rheological properties are available in four consistencies. The condensation silicones, they are available in all four consistencies: light body, regular body, heavy body, and putty consistency. Right? So just like the polysulfides, condensation silicones are also present in the market in all four consistency. The flow property after 1 hour is 0.09%, which is, well, it is good enough. We don't want the material to keep on having the thin consistency, keep on having the property of flow once it is set. We wanted the flowing property to just stop there, so that the all fine details recorded could be reproduced on the cast. Well, mixing time is 1 minute. Okay, that is quite a fast mixing time. The working time is 3 minutes. Okay, that is also suitable. 3 minutes is good enough time for your assistant to mix the base paste and the catalyst paste. The setting time, well, if you remember, the setting time of polysulfide was 10 to 20 minutes, which was quite high. Here, you can see it is reduced to half, 6 to 10 minutes. Okay, 10 minutes is also very high, but as compared to the first elastomer which was introduced in the market, which was polysulfide, this is still the better one, because in that case the setting time was about 20 minutes, 10 to 20 minutes, which is quite a lot. I mean, very close to half an hour. Yeah. So in the setting time, here in case of the condensation silicon, it is reduced to about 10 minutes. Well, still quite high, but okay, that we had no choice at that time, so that is also uh, acceptable, right? When we will move ahead, you're going to see that the other two elastomeric impression material, they have much better properties than this. Okay, now coming to the elastic recovery, it is 99.5, very well, excellent elastic recovery in case of the condensation silicons. 99% is good. Last in the polysulfide, it was 98%. Okay, then it has good tear strength. That is also a very nice property, because we want to record the undercut areas, and that is only possible if we can have a very if we can have a very good elastic recovery, because we don't want our material to tear off, because it is not easy to remove the impression material. You need to give certain movements, certain jerks to remove it, right? So if your material is not elastic, it does not have the flexibility, a good tear strength, then the undercut areas are not going to be undercut areas are not going to be recorded. They are going to tear off, and we need those undercut areas. For example, if you want to make a partial denture, you might have seen those metal clasps. Well, they are going to rest there, right? So, and these undercut recordings are also important for the stability of the denture. It is there for the interlocking of the denture. So, if it is not recorded, it's not going to reproduce on the uh, denture, and yeah, the prosthesis that's going to be formed, well, it's not going to stay in the oral cavity. Well, dimensional stability is still a problem which we were facing, because due to this, the material, the impression material needed to be poured as soon as possible, because it was not good dimensionally. Well, it was due to the polymerization shrinkage, incomplete elastic recovery. Well, we want it as close as possible to 100%. Well, still 99.5%, but not at all the complete elastic recovery. Well, and polymerization shrinkage. Yeah, I'm going to come to it again. As you can see from the name, well, it polymerizes by condensation polymerization reaction. The polysulfides and the condensation silicon, they both get polymerized by the same polymerization reaction, condensation polymerization reaction. It means they are going to release the byproducts, water or alcohol, right? So whenever the water or alcohol is released, it means one of the product, the constituent has leached out, so it's always going to shrink. So it has the polymerization shrinkage, which is a big problem. The thermal contraction on removal from mouth to the room temperature, well, that also adds to the dimensional instability. Okay. Now, let's compare the merits and demerits, the advantages and disadvantages of the condensation silicon impression material. Well, it has an adequate working time, well, and setting time. Okay, that is acceptable, around 6 to 10 minutes. Well, that was acceptable at that time. Later in the coming slides, we are going to see much better properties. Well, it is clean and present order. No staining of the clothes occur. It has adequate tear strength. It can easily reproduce the undercut areas. So tear strength is very important because of the removal, the path of removal of the impression material. Because if you are going to remove it and it does not have a good tear strength, the tear resistance is not good. It's going to fracture. It's going to break. So better elastic properties than the polysulfides, that's good enough. And this also can be electroplated with silver and copper. Uh, yeah, I'm going to talk about the electroplating in the coming slides, so you get the idea very clearly about it. Talking about the disadvantages, the demerits of the condensation silicon, it has lower flexibility than polysulfides. Dimensional stability is also very poor because of the release of the byproduct. So dimensional stability is not getting better. In polysulfides, dimensional stability was not good. Here in condensation silicon, the dimensional stability is again the problem. And that is only due to this condensation polymerization reaction. Only due to this, because it in this reaction the byproduct is formed, and since there is going to be shrinkage, the accuracy is going to be compromised as well. Hydrophobic nature, well, that also adds to the problem, because the impression material, it moves away from the orodental structures, which are always moistened by the saliva. So that also adds to the problems. Then poor to adequate shelf life. Okay, 1 to 2 years of shelf life. Okay, that is 1 year shelf life is considered to be a poor shelf life, really, because as I told you, these materials are not going to be used every now and then on every patient. You need to be very much selective about the patients on which you are going to use the elastomeric impression materials, right? So it should have the shelf life more than 2 years, because these are expensive materials. I mean, one elastomeric impression material, well, that ranges from about 14 to 15,000 rupees. Like it just the one elastomeric impression material. So if you're not going to use that material on every patient. You're going to be very selective about the each and every patient that you are encountering. Like if you are doing a 2 units partial denture, and that two of the polymeric denture base, yeah, the pink ones, right? Well, the patient is not going to give you much money, right? So it should be economical for you as well. You're not going to use this 14 15,000 the rupees impression material for just about 2 3,000 rupees of denture, right? So you should be very much I mean, you should think very critically when you are using or selecting any of the impression material, because it is going to affect your pocket as well. So it is slightly expensive as well. Well, all elastomeric impression materials, they are expensive. So this is not something new. So they are indicated to be used for crown and bridge work, for inlays and onlays. Well, if you have an idea what an inlay onlay is, well, they have very thin margins. I will try to arrange one lecture on the restorations in dentistry. I have a very good lecture on this topic, on which I have talked about all the restorations in the dentistry. So there I have explained each and every one of them in detail. So they are also used to record an impression for the complete dentures as well. Now coming to the third elastomeric impression material, the addition silicone impression material. Well, this was introduced much later than the condensation silicone impression material. Much very, I mean, you can say after a very long time when the condensation impression material were introduced. So this was the third one to be introduced into the market. They have much better properties than the condensation silicone. Obviously, the problems that we were facing in the polysulfides, well, like the bad odor, the bad taste, and the staining, well, that were recovered by the condensation silicones, right? But the dimensional stability, well, these problems were not getting better, they were remaining the same. And even the tear strength, well, that was also adequate, right? Not very good, not good elastic recovery as well. So that these problems were I mean, stranded there, while the other problems, okay, we were getting much better odor, much better taste, um, slightly better elastic recovery in condensation silicone. Okay, good working, good setting time, acceptable one, I would say 6 to 10 minutes instead of the 20 minutes setting time of the polysulfides. But still there were discrepancies, which problems which need to be addressed, and the addition silicon was the perfect impression material to address these problems. So alternatively, this is also called as polyvinyl siloxane or the vinyl polysiloxane. Here, yeah, here you can see its availability in the cartridge form, and then there are mixing tips. I am going to talk about the different mixing methods also for the elastomers, which are very very important. And I will also put some emphasis on one of a very important uh, technique for mixing the elastomers, which is very favorite among the examiners. Okay, and now coming to the properties of the addition silicone impression material, biologically they are highly biocompatible with the oral tissues as compared to any other elastomeric impression materials. These addition silicone impression materials, they are the best among them all biologically. They have acceptable color and taste. Well, exactly what we want. Then coming to the flowing properties, the availability is in all the four consistency: light, regular, heavy, and the putty consistency. Well, exactly. We need all these good properties available in all these four consistencies because we want to record an accurate impression. You can't take chances when you are making a prosthesis for a dental implant. You can't take chances when you are making an inlay, onlay, or a good crown or bridge work, because you have done your very best. Like, for example, if we talk about dental implant, you have done surgery, you have raised the flap, you have inserted the implant, you have taken a good care of your work. You don't want your just one thing, the impression, to ruin everything, right? So you want a good impression. So that's why all four consistencies are very much important. So you can use any of the consistency, any of the viscosity available for a specific application. Okay, here they have mentioned that various consistencies serve different purposes, exactly what I have explained to you. The putty or heavy body is used for primary impression. We are talking here, they are referring to the complete denture formation, and the regular and the light body, they are recorded, used to record the secondary impressions or the wash impression. Addition silicon impression materials, they exhibit pseudoplastic behavior. They are not at all very much rigid, or not at all too much. You can say the consistency is not even too much very low. So they have pseudoplastic behavior, which is very, very uh, necessary in case of the elastomeric impression material. I will also manage this lecture on the different properties, where I will explain each and every one of them in great detail, so you can have a good idea about it. So, talking about the mechanical properties, the excellent elastic recovery. Well, here you see 99.93%, polysulfides 98%, condensation silicon 99.5%. Here we get it 99.93%. So it has excellent elastic recovery. The permanent deformation is 0.07%. Okay, that is acceptable. Flexibility is 3%. Yes, we are fine with it. Now, if we flow after 1 hour, okay, we are good with it. Now, coming to the working, mixing, and the setting time. Well, now here you see this impression material, this elastomeric impression material, is getting better, best. It is getting all those properties, all those problems which are being faced by the previous ones. Well, it is doing its level best to recover them, to get much better thing to give, to serve in a much better way. Like the setting time is about 6 to 8 minutes, right? So in the polysulfides, it was about 20 minutes. Then it was reduced to 10 minutes. And here, 6 to 8 minutes. Well, good one, I would say. Uh, Still acceptable. 8 minutes is, well, acceptable in case of the addition silicons. Now, if we compare the advantages and disadvantages, advantages are much better, I would say. It records highly accurate impressions, exactly what we want, because we have done some great work, some implant surgery. We have done the tooth preparation by following all the protocols. So we want our impression, our prosthesis to be accurate as well. So, and this addition silicon, it serves our purpose. It is pleasant to handle, acceptable taste, shorter setting time. Well, that's good. These all are good properties, right? The excellent elastic recovery, 99.93%. What else do you want? So, no elimination of any byproduct. Why? Because it is addition silicon. It polymerizes by addition polymerization reaction. So, no byproduct is formed. So, it gives you much accurate results, and dimensional stability as well, because there is no byproduct formation, so it stays dimensionally stable. It can be electroplated with silver and copper. That is a good thing. I'll elaborate this electroplating very soon in the coming slides. So multiple die pouring, well, that is also possible. So it serves all our requirements. What exactly do we want? It is giving us everything. So disadvantage is the cost. It is more expensive, and the mixing machine for this, well, it can also be mixed by the other method as well. I'm going to explain them soon. So it is rather, it is really expensive. I mean, it is much more expensive than the polysulfides and condensation silicon. Polyether is the only material which is much more expensive than this addition silicon. And I'm going to tell you why it is. Okay, it has shorter working time, but so your assistant needs to be very, very efficient. He should be very, very I mean, master in mixing these addition silicon, because of its short working time. And secondly, you don't want to waste this material. It is expensive, right? I told you that each of the impression that you record, it costs about 6 to 700 rupees, a single impression. And if your assistant is not technical enough, he's going to waste it. So he should be very expert in mixing these elastomeric impression materials, because they have shorter working time, this, especially this addition silicon one. In some cases, it may release hydrogen gas because of its presence in the chemical formula of the addition silicon in the vinyl group. So it is very rare as well. It is hydrophobic material. So all these disadvantages advantages are very, very small, you can say, as compared to the advantages. It is giving us more than it is taking away from us. So that's a good thing. Well, it is indicated to be used to record the impression for the crown, bridges, inlays, onlays, partial and complete dentures. So we can use it, and also add the implant for making the implant prosthesis. You can also add this here as well. Then lastly, the fourth one is the polyether impression material, which was introduced very late in 1960s in Germany, and commercially they were named as Impregum and Polygel. Well, these were the commercial names of the polyethers. Well, this is the only elastomeric impression material. Mind it, this is a very important Viva question. I can simply ask you, name only one elastomeric impression material which is not available in all the four consistencies. This one is that material. This polyether is the only elastomeric impression material which is available in just three consistencies. There is no putty consistency of polyether impression material, right? So this is the well, these such viva questions, they seem tricky, but I will like to mention them as well during the course of my lecture, so you can note it down, and you have these things in your mind once you prepare for your exam. Okay, it is dispensed in three paste system: base paste, reactor paste, and the modifier paste. The modifier paste, well, it is a thinner paste, you can say, to make the mixture workable so that your assistant can easily work and manipulate the material. Talking about the properties of the polyether impression material, biologically it is non-toxic, non-poisonous, but in some cases some irritation is seen due to the sulfonic acid which is present in the reactor paste. But this is very rare. It can also cause the hypersensitivity reaction in some patients due to the presence of the ethylene amine. Well, the spellings are not right. Ethylene amine ring in the base paste. So these cases are very rare, very rare. That's why the history is very important. When you ask about the history, you should ask about the allergic reaction if the patient encounters them as well. So then you can avoid them. So rheologically, it is only elastomeric impression material available in three consistencies: light, regular, and heavy body. No putty consistency for polyethers. So flow after 1 hour is 0.03%. Okay, we take that. It's not a big problem. Mechanically, the elastic recovery is 98.9%. So it has reduced. So elastic recovery is best in the polysulfides. Sorry, in the addition silicons. It is best in the addition silicons. The elastic recovery here in polyether, it has reduced to 98.9%, whereas in addition silicon it reached up to 99.93%. So permanent deformation is 1.1%. The flow is flexibility is very low. It is a very rigid. The stiffest of all the elastomeric impression material is polyether. This is also an MCQ. So working time is 2 minutes. Setting time is 3 to 5 minutes. So that is also acceptable. That is good enough, I would say, keeping in mind the polysulfides which had the 20 minutes of the setting time. So 5 minutes is good enough time. That's normal, just normal. So good dimensional stability due to addition polymerization reaction and less polymerization shrinkage. So advantages, well, just keep this thing in mind. So okay, I'll talk about it after these advantages and disadvantages. I want just few things to be very much clear. So advantages is good pseudoplastic properties, that it means that the same mix can be used as tray as well as syringe material, so there is no change in the properties. Dimensional stability is also very good. Less polymerization shrinkage, no byproduct formation. Well, this is the thing I wanted to talk about, which I said I will talk later. But here I should mention it. Well, be very clear. There are four elastomeric impression materials: polysulfides, condensation silicon, addition silicon, polyether, right? Polysulfide and condensation silicon. The first two, they polymerize by condensation polymerization reaction. That's why their dimensional stability was not good. That's why there was a lot of polymerization shrinkage. That's why there was a release of byproduct due to condensation polymerization reaction. The other two that we have discussed, the addition silicon impression materials and polyether impression materials. Well, there is a very clear line that these two polymerize by addition polymerization reaction. So no byproduct form, dimensionally stable, no polymerization shrinkage, or very less, right? So this polymerization shrinkage, it has the two is are polymerizing by condensation method, and the last two they are polymerizing by the addition polymerization reaction. So be very clear about it. It should not cause any confusion in your mind. Then the cast pouring can be delayed for the well, the cast pouring date can be delayed for few hours, even for a week. Well, that's the main reason why this material is very, very expensive. This polyether is the most expensive of all the elastomeric impression material. Why? Well, in some cases, let's suppose you're working in a remote area and you do not have a lab technician in your area where you are practicing, right? So you have to send your impression to other city, the technician who is settled in some other city, right? So if you will take impression from any other material, it's going to distort, it's going to just you can say it's not going to last for much longer time. The stability is going to be compromised, but this polyether is the only impression material which can reproduce, or which on in which case the cast pouring can be delayed to about 1 week. So you can simply record an impression, you can send it by courier to any other city, and it can still reproduce the same fine details. So that's why this is the most expensive of the all impression materials. Now, okay, now long shelf life. Well, that is also a good advantage. I told you that 2 years is the minimum one. Don't buy any material which has the expiry date less than 2 years. That's the rule of thumb. Okay, disadvantages, very expensive when compared to the other elastomers. I have told you why it is very expensive, because of its delay in the cast pouring. For others, you have to pour the cast as soon as possible, but here in this case, it is very much, suitable for those dentists who are working in some villages or remote areas. So they have, 7 days time is good enough time to pour a cast. So they can easily courier it or send it to a technician in the other city. So that's why it is very expensive, because of this property. High stiffness, it is, I told you, the stiffest of all the elastomeric impression material is the polyether. Low tear strength, well, okay, that we can compensate for that. Electroplating, well, that is not easy. This is the impression material on which electroplating is a problem. Patient can be sensitive to the catalyst, well, but also in very rare cases, so not much of a big deal. Not available in complete range of viscosity, that is also a very big disadvantage. You don't get a putty consistency, whereas the other three elastomers that you just went through a few moments ago, well, they were available in all the four consistencies. Used to record the impression for crown, bridges, inlays, onlays, and the complete denture. So you can easily fabricate these prostheses by using the polyether impression material. Then when there is also a modification of light cured polyether impression material, well, they are also available. They are bit more expensive than the conventional polyether, and they can be cured, or they can be set by the blue light. So only because of the presence of the photo initiator here, the photo initiator, this one, the camphor quinone, which is the photo initiator for the uh, light activated polyether impression material. So only because of this camphor quinone, the patient feels very comfortable as they are set by the polymerization, light activated polymerization. Then the mixing systems for the elastomers. Well, there are, I'm going to go through the mixing systems, how you're going to mix the elastomers. I'm going to go through them one by one. Well, there are three types of these systems which are used to mix the catalyst paste and the base paste. I told you they are available in two forms, catalyst paste and the base paste. So there are three ways by which you can mix them. Number one, the static mixing system. Then the second one is the auto mixing system. And the third one is the dynamic mechanical mixing system. Now, talking about the static one. Well, static one is the manual mixing, you can say. Here you can easily see in the picture, it is just like the zinc oxide eugenol impression material mixing, where you dispense both the base paste and the catalyst paste in equal lengths. Keep this thing in mind that the quantity is only based upon the length of the materials, the two materials that you are using. You should use them in equal lengths. Okay. Impression paste, well, they are dispensed in the form of the collapsible tubes. Here you can easily see these tubes. You can easily appreciate them. The equal lengths of the catalyst and the base paste, they are dispensed on the wax paper pad. Here, the wax paper pad, you can easily appreciate the presence of the two tubes. Here, the initial mixing is done by the circular motion in which you give broad strokes to both the tubes, the base paste and the catalyst paste, and then in this case you get a homogeneous mixture. Well, keep this thing in mind that whatever the color of the individual tube is, you will get an intermediate color of the both of them. So that will is the criteria for use of the static mixing system. Well, final mixing is done with the broad strokes of the spatula. The final mix should be smooth. Mixing is ready in about 45 seconds when you get the homogeneous color, and then all four types of elastomers, they can be mixed by this method. Okay. Then coming to the second one, the most popular and most commonly used mixing system for the elastomers, which is auto mixing system. Here you can see the mixing gun. Here it is. Then these are the cartridges which are attached to this gun, and this is the mixing tip, right? So when you press the gun, the plungers, they go inside these cartridges, and a fine smooth mixture comes out of this mixing tip. So let's go through this process. It is a very popular and most commonly used mean for mixing the catalyst paste and the base paste. The base and the catalyst paste, where they are in the form of cylinders, I told you, in the form of cartridges, uh, which is fixed to the mixing gun. The cartridge is placed in mixing gun containing two plungers. Here behind these cartridges, well, here it is attached to it, but if you will remove it, you will see two plungers which will go inside these cartridges. So whenever you press it, they will move ahead, they will press the material ahead, and here in this part they get mixed and then come out from this tip. Okay, equal quantities of both the base and the catalyst paste, well, they are forced through the static mixing tip. This is the static mixing tip, this one. You just force them by pressing this mixing gun. The tip contains stationary internal plastic spiral to mix rather both the components over each other and get a uniform mix. That's exactly what our requirement is. You keep on pressing this amalgam gun, this mixing gun, and you get the uniform mixture out of this tip. So the first part of the mixture, well, this is the rule of thumb. This is a very important point, that the first part of the mixture, well, this needs to be discarded. Just keep this thing in mind, because this is the most popular method for mixing the elastomers, right? So you are also going to mix by this method. just discard the first mix that comes out of this mixing tip. Just discard it. Why? Because it's not a uniform mix. It's just the remnant of the past mixing that was done. It is not at all a uniform mix, so just discard it. That's the rule. Then, in the seventh point, you can see that mixing material that can be extruded directly either onto the injection syringe or the impression tray. So you can easily just take the material out either in the tray or into the injection syringe, so that um okay. So you can easily, you can easily just dispense it according to the use. If you want to record the wash impression, you just put it in the impression tray. Okay. There is also a chance, if you look at this point 8, intraoral injection tips can also be placed at the end of the static mixing tip. Is this one, you can also place a very thin intraoral injection tip here as well, because let's suppose if you want to record an impression of a cavity, you want to make an inlay, right? And so that's a very, the tooth is very small and the cavity you will make is even more smaller, so you need to add a very thin intraoral tip just ahead of it, so you can easily dispense directly onto the tooth. No tray, no nothing else, then you can insert the tray and get the impression. I will talk about the technique as well in after this. Okay. And the material left at the tip, well, it gets wasted, but still the waste here is 3 to 4 times less than the normal in the static mixing, the manual mixing. There you had such a large mixing pad, and the lost material was very much in quantity. The wastage was too much. But here the wastage is still there, but 3 to 4 times less than that. So we are happy with that. Okay. Now let's. Okay, silicons, both addition and condensation, and the polyether, well, they are available to be mixed by this method. And then the third one, the dynamic mechanical mixing. Well, this is the most expensive of all the mixing methods, and well, not everyone has this mechanical mixing machine because it is very expensive, and it adds to the cost of your dental impression. So we just prefer this one. Even this mixing gun, this is very expensive, about 3-4 thousand, but this one is in really, it has a really big price, yeah? So we normally don't have this, but still we should know how it works. Well, it works on the same mechanics as the previous one, the auto mixing method. It works on the same mechanics, but here it is done mechanically by electricity. So it is a newer system. The catalyst and base paste, well, these plungers are placed inside this machine. The cartridges are inserted into the top of the mixing machine, and then you press the button, and you just the smooth mixture, it comes out of the mixing tip. On pressing the button, parallel plungers, they push against the plastic bags, thus opening the bag. The plastic bags are present inside, where the mechanical plungers, they just break it, and then the mixing starts. Material is forced into the dynamic mixing tip. This is the dynamic mixing tip. This is. Okay, mixing tip. Well, it differs from that of the auto mixing, because in that case, in auto mixing type, only the forward movement was occurring. But here, in spiral as well as the forward movement, the rotation as well. So forward as well as the rotational movement is also going. So you get a much better mix by this method. But the thing is that this machine is very expensive, so we mostly don't afford it. So mixing is accomplished by a rotation as well as the forward motion of the through the spiral. The plungers which are present inside, they rotate as well as move forward, so we get a smooth creamy mixture. So advantage of this in this case is the thoroughness of the mixture, and but the disadvantage is obviously the cost of this machine. So these were the three systems by which you can mix the elastomers. There is no fourth system, these three systems. Now coming to the technique, what are the impression techniques used for the elastomeric impression material? There are three impression techniques are used for recording the elastomeric impression material. Well, the first one is the single viscosity or the monophase impression technique. Well, as the name indicates, this is the monophase. It has the single phase, single viscosity technique, often taken with the medium viscosity material. As I've told you that every material is available in four consistency except the polyethers: light body, regular body, heavy, and putty consistency. So you can choose any one of these viscosities to record this impression. So when forced through the impression syringe, the viscosity decreases, but when used in the tray, the viscosity is unaffected. But that's the highlight property of the elastomeric impression material. So, in a nutshell, you can simply say that you can use any of the four consistencies and use it for the monophase, just one consistency. Addition silicone and polyether are well suited for this technique. Okay. Then comes the second one, which is the dual viscosity technique. The first one was single viscosity technique. This is dual viscosity. As the name indicates, two types of viscosities can be used in this in recording this impression. Simultaneous or multiple mix technique, well, that's the alternate names. Low consistency or low viscosity material is injected with a syringe onto and around the critical areas, and a high consistency material is mixed and placed in the tray. So we have two consistency: low consistency or light body, or regular or high body. We place the high body or regular body inside the tray, and we just get an idea from where we are going to record an impression in that critical area, from where we get the fine details. We want to get the final details. There we inject the low viscosity material, and then we put it into the patient's mouth, and then we get both the viscosities bind together and set together. Both the materials, they join and set together. Yeah, exactly what I've mentioned here. So just insert all the material in the tray. The bulk material is of high consistency, and then this blue one, the purple one, you can say, um, it is the low consistency material. And then you insert it into the patient mouth. You get fine details with the help of low viscosity material in the critical areas, and then this all is the bulk material in the high consistency. So now we have discussed the single viscosity and dual viscosity. Here comes the most favorite and most asked impression technique of the by the examiners, which is putty wash technique. It is a two-step impression procedure. Preliminary impression is taken in high or putty consistency material before cavity preparation. So keep this thing in mind, that this is also a dual viscosity technique, but this is different. How? That first you record the preliminary impression. The first impression you will record, you will, let's suppose you're going to make an inlay or onlay, whatever. Before making the cavity, you just record the impression with the bulk of the material inside the tray. Then the cavity is prepared, as mentioned in the third point. After preparing the cavity, a low viscosity material is syringed onto the prepared cavity. You syringe it directly into the prepared cavity, the cavity that you have prepared. You just syringe it there. Then you reinsert the preliminary impression inside the patient mouth exactly at the same position, and preliminary impression is then reinserted. The low and high consistency material, they bind together. When low viscosity material sets, the impression is removed. You can then easily remove it from the oral cavity, and then you will get the finest impression you will always dream of, because in the fine areas you have recorded with the low viscosity material, and you have created the bulk of the material when you recorded the preliminary impression. So technique developed for the condensation silicon to minimize the dimensional changes. Well, but you can use it for any any of the elastomeric impression. Now coming up about the duplicating impression materials, I have told you that we have studied it. We have just told you about it, that multiplication of cast. There are some materials which are not suitable for multiplication of the cast, like condensation, silicons, etc. But here I'm going to give you just 2-3 slides to just make you understand what exactly duplication is, and why exactly do we need it. So duplicating materials, well, they are used to duplicate the cast. So there are two types: either they are reversible or irreversible. Agar, or the agar is reversible, and then there is polyvinyl chloride gel. Well, not most commonly used. Agar is most commonly used. So irreversible, it is alginate and the silicons and polyethers. So these are the duplicating materials. So now, so what is the purpose? Why we need to duplicate a cast? Well, just keep this thing in mind, that there are two types of casts. One is the diagnostic cast, the other one is the working cast, right? You have recorded a very well impression, you have made the first cast. You should have a material which could reproduce that cast again, which can record the impression of that cast, so that you can get a diagnostic or working cast. Because working cast is going to be sent to the lab. All the procedures are going to be done on that cast. So finally it will break, and you will just get the prosthesis. But how you're going to check the prosthesis is by the diagnostic cast that you make. So that's why duplication is important. More than one cast should be made, ideally. Although it is not a practice, but ideally it should be made. Okay, both types of the hydrocolloids are used in the dental lab for the duplication of the dental cast or model. So reversible hydrocolloids, sorry, the reversible hydrocolloids are more popular as it can be used many times and can be stored in liquid for more than 1 to 2 weeks. So that's the big advantage. Reversible materials, well, you can use them again, and as the name indicates, right? So, and they can be stored for 1 to 2 weeks. So that's what else do you want? The disadvantage is same as that of agar impression material. What exactly is the disadvantage? Which is the dimensional instability. It is a thermoplastic impression material, so due to temperature the changes may occur. But always it is preferred that the material should be reversible, because then it becomes cost effective for the dentist. Like if you will use, like here we have seen that the silicone and the polyethers, they are also used as the duplicating material. But as I've told you, that polyether is the most expensive, and so are the silicons. They are also very expensive. So you would like to avoid them for the duplication of cast. So these duplicating materials have the same composition as that of the impression material, but there is a difference. The difference in the water content. But the water content is high, and agar and alginate content is lower. So okay, the as the properties, the composition have changed, so that's why the use has also changed, because we need them now for the duplication process, not for recording the impression. So we just take an impression, make a cast, and then we use the duplicating impression material and take the impression of the cast to reproduce the second cast. So such materials are very much helpful, especially the reversible one for the duplicating process. Silicon and polyethers, well, these are the examples of the irreversible and non-aqueous type of duplicating material. I've told you, but the disadvantage is mainly the cost. They are very expensive, so we just avoid them. Now, just a brief talk about the electroplating of the dental materials. What exactly is the electroplating and why it is preferred? The process by which a metal surface is deposited on an impression is called as electroplating. Well, we just introduce a very thin film of the metal surface onto the dental impression. Um, well, it is only due to the fact that we want maximum dimensional stability for our prosthesis. right? So that's why we use the electroplating. Well, this is very time consuming method. Just keep this thing in mind. So it is not practiced normally. So impression compound, polysulfide, and silicon impression material, well, they are electroplated. Polyethers, as I mentioned before, well, they are not electroplated. They are not easy to be electroplated. So we just omit that and just polysulfides, silicons, and impression compound. Well, these are the materials which are used for electroplating. A metal film is deposited on a non-metal. Obviously, this impression material, well, they are non-metallic in nature, they are polymeric. So they need to, in order to make them conductive, because only then the current is going to be passed. So in order to make them conductive, a metal film is deposited on them. I'm just going to tell you how it is going to happen. The process is also called as the electrodeposition or the electroforming. These are the alternate name for electroplating, so also keep them in your mind. So if there is any change in the name in the exam, so you should not be confused about that. You should know that they are asking about the electroplating. Well, impression material, impression surface that is made conductive by the graphite powder. The graphite powder is just spread all along the surface of the dental impression, which makes it much more which makes it conductive, because it is, as I mentioned, it is a non-metallic material. So to make it conductive, we have to convert it into a metallic one. So graphite powder is used. And most commonly silver and copper are the metals used for the electroplating procedure. So just I'm going to I just collected all these steps so that it becomes easy for you. It's just I've just used some easy words so you can easily understand them and reproduce them in your exam if the question is asked. First, we wash and dry the impression material. You just record the impression, you wash and dry it. Then the second point is the impression is attached to cathode holder by the insulating wire. So impression is attached to the cathode holder. The metal which you want to deposit onto the impression material, well, that is attached to the anode, right? Okay. The metallization is done like the graphite powder. You just spread it on the dental impression. Copper ring is also present there in order to confine this whole process in a specific boundary. Impression is filled with the electrolyte. Well, this electrolyte is there for the conduction of the electric current. The impression is immersed in the electrolyte bath. The bath has the solution is the one in which the electrolytes are going to be moving. So impression, as I told you, is attached with the cathode, whereas the metal, silver or copper metal, which you want to deposit on the impression, that is attached to the uh, anode. And then, well, this is a general rule that 10 milliampere current per tooth is adjusted. Well, it will be obvious from your dental impression that how many teeth you are going to for how many teeth you have recorded that impression, right? 2 3 teeth, 3 teeth they were missing. So for every tooth, 10 milliampere, this is the rule here, 10 milliampere current is adjusted for each tooth. So if there are 3 4 tooth, you just multiply it by 2 or 3, whatever the tooth missing are there. So here, this the ninth point. This is the thing which I was saying, that this is very much time consuming method. 12 to 15 hours are required for the electroplating procedure. Just we do it to minimize or reduce the dimensional changes in the dental impression. So it takes about 12 to 15 hours. So after this time, we disconnect the current, we wash the impression, and then make a dye with the resin or the hard or extra hard plaster. Copper ring is then removed, and your cast is ready. The advantages of electroplating, well, dimensional accuracy, you get the accurate impression. Then you get a very hard impression as well, because it is covered by the metal surface. Abrasion resistance, so if there is any sharp instrumentation which is used, it's not going to cause any harm to your dental impression there. So better marginal definition. So margins are also very well defined in once you electroplate the dental impression. Then it imparts the smooth surface to the wax pattern in contact. So wax pattern formation, well, it also gives some smooth surface to that as well. It is inexpensive. Okay. The disadvantage, well, for me, the biggest disadvantage is the time. 12 to 15 hours time are required for electroplating procedure, which is, well, in this time you can easily fabricate the whole prosthesis. So this is the big disadvantage. Difficult to trim. If in case this there is some metal surface, you can easily trim it, but in case here the after the electroplating process has done, you cannot trim the metal surface because the metal deposition is already there. So that's going to cause a very big problem for you. The silver bath, well, that's a health hazard. Silver has its own health hazards. So there can be issues regarding the operator's health. While not compatible with all impression material, all impression material, they cannot be electroplated. Only impression compound, polysulfides, and the two silicons, elastomeric impression material, the addition and the condensation one, only they can be electroplated. Well, it gives a very bad color contrast here. If you can see, the color contrast is not at all good. I mean, that is, uh, I don't find it very much aesthetical. Anyways, well, wax pattern lifts from the margins, as the margins have the metal surface there. So once you prepare the wax pattern, they just get lifted from there. So there is a problem that could be faced once you try to reproduce the margins. So lastly, the cross infection, the disinfection of the dental impression. Well, it is very important to disinfect the impression before sending it to the lab for making the models or prostheses or appliances. So you should be ethically, it's our duty. It's being a dentist, or if there is a technician, you have an assistant. After recording the impression, disinfection must be done to avoid the cross infection. Important for the protection of the laboratory staff from any transmissible disease. Well, you have taken the history, you have recorded the history, so it's very, very important that you disinfect your dental impression before sending it to the lab, so that if there is any transmittable disease, well, that could be avoided. Well, the properties of the impression material needs to be kept in mind before using any disinfectant. In the coming slide, I'm going to show you. I have categorized. I've made a table of each and every impression material, so that it could be very easy for you to remember. Here you can see the impression material in the first column, then the method by which it is disinfected, then the third one, the disinfectant which is used, or then the fourth one, any comments or any extra care that you need to take. So these are the four categories under which I have discussed all the impression material. Let's talk about the alginate impression material. The method is immersion. It is immersed for about 10 minutes in the disinfectants. So what exactly are the disinfectants used for the uh, alginate impression material? There are two disinfectants which are mentioned here: chlorine compounds and the iodophores. Okay, I'll explain each one of them, a little detail about them, so you get the clear idea about what exactly is a chlorine compound and iodophores, whatever. So let's talk about the chlorine compound. The chlorine compound, there are two types of chlorine compounds actually. The sodium chloride, which is the normal table salt, and the hydrogen chloride, right? So these are the two chlorine compounds which can be used. You can note it down uh, if you are making notes while taking this lecture, that sodium chloride and the hydrogen chloride are the two chlorine compounds which are used. They are inexpensive and they are fast acting as well. That's their advantage. And the effectiveness of these chlorine compound is against all types of bacteria and any enveloped or non-enveloped viruses and fungi, so they can easily kill that. So the process is of immersion into the chlorine compound for about 10 minutes, and then you get the desired result. The second thing which is mentioned is iodophores. What exactly the iodophores are? Well, iodophores are basically it is an iodine-containing solution which is widely used for disinfection procedure. Um, it is basically an antiseptic that kills all the bacteria and pathogens. So that's why it is most commonly preferred to disinfect the dental impressions. So you immerse it for 10 minutes either in chlorine compound or the iodophore, um, and you get the alginate impression material disinfected. Well, in the comments here, it is mentioned that short-term glutaraldehyde has been shown to be acceptable, but the time is adequate for the disinfection. So we don't use glutaraldehyde here. Okay, now coming to the second one, the agar. Well, the method is the same, immersion. You just need to immerse the agar impression into the uh, disinfectant solution. So, what solution is sodium hypochlorite, which is used uh, to disinfect the agar impression material? Well, sodium hypochlorite basically, well, it is a chloride solution of sodium, NaOCl. Well, that's the its formula. First, what you do, you just spray your impression material with 1% sodium hypochlorite, and then you immerse it into its solution for about 10 minutes. Well, that's the procedure. That's how you're going to do it. And now coming to the polysulfide silicones, both polysulfide and addition and condensation silicon. Let's talk about them. The method is the same. The immersion, you need to immerse it in the glutaraldehyde or chlorine compound or the iodophores or phenols. Glutaraldehyde, basically, glutaraldehyde is a chemical that is used as a cold sterilizer, for cold sterilization actually, to disinfect and clean the heat-resistant dental equipment or any dental material which are resistant to heat. So we can use the glutaraldehyde to disinfect them. And here, both polysulfides and the silicones, well, they are immersed in the glutaraldehyde or chlorine compound iodophores to disinfect them. So now, lastly, coming to the polyethers. Polyethers, you just immerse with caution less than 10 minutes always into the chlorine compound on iodophore. So any one of them you can choose, and you can use to disinfect the polyether impression material. The process is the same, the method is the same, immersion. Zinc oxide usually impression paste. It is also the immersion process is used. It is always preferred, but spraying can also be used. So you can use either one of them. Either you can do it with glutaraldehyde spray or the iodophore spray. Okay, the chlorine compound must be avoided. Here it is mentioned that chlorine compound must be avoided. Although you can use the phenolic sprays, but not indicated. Chlorine compound is not indicated. Then the impression compound, the immersion process is the method, and spraying can also be done just like the zinc oxide eugenol impression paste by the chlorine compounds and the iodophore, and phenolic spraying, they can also be used. So this I have really summarized all the impression materials. I've just made this lecture from 3 or 4 books. I don't exactly remember. So I've collected all that information in these tables, so you can easily go through them and you can easily memorize them. The process is almost the same. Either you immerse or you just spray with the disinfectant, and off you go. You get your dental impression material disinfected. So that was a lecture on elastomeric impression material. I hope it was informative, and I've tried my level best to brief each and everything regarding the elastomeric impression materials to you in an easy language. We have talked about the elastomers, their properties, their advantages, disadvantages, and then I have also discussed about the mixing methods and the impression techniques. Then we have talked about the cast material, duplicating impression material. We have talked about the electroplating, and then lastly we have talked about the disinfection of the dental impression. I hope this was a very informative and useful lecture. Do give me your feedback in the comment section below. And if you have any questions, do mention them. I will get back to you and answer each and every question. I would really appreciate if you could give your feedback, because that will really give me some encouragement. And inshallah, we'll come up with more better lectures on DentoScope Studio platform. Do subscribe to the channel so you get all the updates, and also like and follow DentoScope on the Facebook page and also on the Instagram. Thank you very much, each and every one of you. I hope you all gathered some useful information. Thank you very much. Take care.